Hi, I'm Becky Gerber. This screencast video, Keystrokes for Practice Analysis Reports using Dentrix, is in response to some of the most frequently asked questions when analyzing a dental practice. So whether you are a broker appraising a practice, a doctor doing their due diligence, or an administrator monitoring the statistics, this video will help you obtain a lot of valuable practice information. Okay, let's get started. Our first question is, how many active patients? And how are we defining active patients? To start, we will be accessing all of our reports in the Office Manager window in the Dentrix. And the Office Manager is this icon right here. It is the brown chair on the desktop. Once I click on it, it opens up into the batch processor. Once I'm in the batch processor, I'll go to Letters and Custom Lists in the upper left corner, and then scroll down to Miscellaneous, scroll down to Patient Report by Filters, and then click on Edit to the right. This launches into the list of filters that we will be printing on our report. In the top corner, we want to make the from and the to names from the first A in the alphabet and to the last Z in the alphabet. If it has not already defaulted, we can open that window and it will launch into the Select Patient, and just click AA, search, press OK, and then in the To window, open the window and search for the last Z in the alphabet. Once we have that field, then we go to Status, and we want Patient Status. To the right, Gender, male and female. Position, we want all checked. And Balance Aging, we want all checked. The first column underneath, we want to now go to all, or have all clicked for a provider, have all clicked for a billing type. And then we move on to the second column and scroll down to the first visit date. Once you're at the first visit date, you can open that window and you can select a beginning date and an ending date. And for our purposes, I put the beginning date of July 1st, 2019 to July 1st, 2021, and click OK. The next area for our filters will be the data fields, and we'll click on Patient and just click on OK at the bottom of that window, and then open in Notepad. This is now going to do a scan of the number of patients in the system, and now we can go all the way down to the bottom of that page, highlight the last name on the page, and then go to Edit in the toolbar. Once you've opened Edit in the toolbar, go to Go To. And that now will give us the number of the active patients that have been in the practice in 2 years. The answer to the second part of the question is the dates that we put in the field for a first visit date. And so we can put whatever date we want in there. We can take it back 3 years, 2 years, 1 year, whichever we prefer. But that is the answer to the second part of that question. Question number 2. Where are the patients from? What is their age and gender? We still have the batch processor open in our Dentrix. And from here, we are going to go to the word reports in the upper left corner, management, and scroll down to practice statistics report. We'll now get a window that says send practice statistics report to batch processor. Click yes. Once that's in there, we can highlight, double click, and open up that report. Now this report contains a lot of valuable information that we will be looking at later. So to print this, we can go to the word File and Print Report. Choose your printer and then click on OK. Question number 3. How many new patients does the practice see in an average year and an average month? How many last year? For this list, we go into Reports, Lists, New Patient List, and in this filter we put From and To All, and select Provider All. It should already be defaulted, but now we want to put in our first visit date range to our last visit date range. So I am going to continue to use the date July 1st, 2021 to July 31st, 2021. We want to have a standard list, and then with that just press OK. Once it's sent to the batch processor, we can highlight, double click, open that up, blow that up, and we can see how many new patients each provider has had in that month. We can now print this report by going to the word File, Print Report, choose our printer, and then press OK. Question number 4. How much did the practice collect? Look at 3 years prior and the year to date. For this report, we go to the word Reports in the upper corner, Management, and Day Sheet. We select the provider From and To All, the billing type All, From and To, and the date range. And this date range can be whatever date range you select, whether it's 1 year, 2 years, or today's date. I am going to change that date to the date we've been using. So this is July 1st to July 31st. Select entry date, and remember that we've selected entry date, and this we will use for all of our reports. Over on the right, select totals, include month to date and year to date, include provider totals, and then we also select compare to fee schedule. This number will come out on the day sheet and will show us how much the doctor would have produced if not contracted with the PPOs. I'm going to select chronological day sheet, but deselect adjustment only day sheet and deposit slip. We will be creating these reports a bit later in our questions. Press OK. And then in our batch processor, we can highlight and double click, and that will give us a print preview. And we now have the production for that date range. And that production is, in my fake office, 25,210. If my fake office had not accepted PPOs, the number would have been 29,810. The difference is 4,600. And then here's collections for that date range as well. I'll blow that up. And if we want to print that, we go to the word File in the upper corner, Print Report, select our printer, and then press OK.
Question number 5. How much did the practice produce? Look at 3 years prior and year to date.
The production numbers can be found in the day sheet that we just generated and printed, but we also have another report that we can look at that's just as good, and that is go to the word analysis in the toolbar and then practice. You may get a window that is saying that the month has not been closed out, and this is just a message letting you know. So I'm going to default through this and press OK. And once you get the analysis window, go to the word reports, and then it launches into the window that says practice analysis reports. For the provider, I'm going to choose all, and for the billing types, I'm going to choose all. Now for the date range, I'm going to use the date range that we've been using all along in all of the reports. And I am going to click on entry date, which we've been using on all of the reports. I want to make sure that they stay consistent. Under select summary reports, we deselect include cross-coding. We just want the production summary and by category. We also want to look at payment summary. I'm going to click on either print or batch. If we send it to the batch, then we can print it on our printer within our office. I'm going to close out of that, and it went to our batch processor, highlight, double click, and there is our print preview right there. And this is going to give us the categories and the percentages, and this report will also break it out by provider if we so choose those filters.
Question number 6. How much did each provider produce? What procedures did they perform? Go back 3 years and look at year to date.
For this report, we are going to run it and view it basically the same way that we looked at the report for question number 5. So go to the word analysis in the toolbar, practice, and if you get this message again saying that the month has not been closed out, just click OK, and then go to the word reports in the toolbar, and now you can deselect all and select which provider you want to look at for the report. I'm going to choose me. I'm going to keep all the billing types clicked, and then again the date range. And I'm going to keep it on entry date, and then deselect include cross-coding, and I have the payment summary. I am now going to go to batch, and it went to the batch, and now I can go to my report and do a print preview, and this provider is ADPC, me, and if I want to print this, the word file, print report, select printer, and OK.
Number 7. How much did each procedure category produce as a percentage of the total production, and what percentage is hygiene?
Once again, these numbers can be found in the practice analysis report that we just generated. And so what I'm going to do is go up to the first practice analysis report in the batch processor, highlight, double click, and open it up, blow it up, and here are my percentages by category of what the production was.
Number 8. How much does the practice collect from cash, checks, insurance, or third-party payers?
Once again, we select Reports, Management, Day Sheet. For provider, we have all. For billing types, all. And then we change our date range to whatever we would like. Keep it at entry date and then deselect totals and deselect day sheet, deselect adjustment only day sheet, and click OK. We can now view by highlighting and double clicking and opening the report. And once again, go to the word File and Print Report, choose Printer, and then OK.
Number 9, how much does the practice adjust off? What are their write-off policies and adjustment types?
This report is a repeat of some of the previous reports we did, and I will show you one with the exception of some of the filters. We go up to the word Reports, Management, Day Sheet, and I'm going to select a longer date range so that I can show you more in the adjustments in my fake office. I'm going to deselect the totals, deselect chronological day sheet under report types, keep adjustment only day sheet highlighted or clicked, and then deselect deposit slip. Press OK, and then highlight, double click to print preview, and I will blow this up. And here are my types of adjustments for this date range. And then at the end of page 5, I have totals. In order to print this report, go to the word File, Print Report, select Printer. As I mentioned earlier, some reports can be found in different areas in our Dentrix, and some reports duplicate numbers. So I'm going to show you a second way to look at the adjustment report, and that is by going to Analysis in the toolbar and then Practice, and we'll just click OK to default through that window, and then Reports. We have all providers selected and all billing types. We're going to keep the date range on entry date, but I'm going to change my date range to a different date in the past, and then deselect Production Summary and deselect Payment Summary and select Adjustment Summary. I'm going to send that to the batch to view, and then highlight, double click, and I can blow this up, and it has all the adjustment types. They are titled, and then the amounts, and at the end of the second page, we now have the total. Go to the word File, Print Report, and then select your printer, and OK.
Question number 10, how much does the practice have in accounts receivable? And what is the aging breakdown of the accounts receivable?
We still have the batch processor open in our Dentrix. And now we are going to go to the word Reports in the toolbar, Ledger, Aging Report. We can now select whatever guarantor we want, but for our purposes, it's all, provider all, and billing types all. Under minimum days past due, I usually click on over 0. And we're going to sort by guarantor name. Select report type. We are selecting standard aging report. And then press OK. highlight, double click, and we can print preview. And this also gives us the aging of the accounts receivable at the very end of that list. I have 14 pages in mine, and I'm just going to scroll over to the end of the 14th page and blow this up for you. And here are our totals. Here is our aging, 31 to 60 days, 61 to 90, and over 90 days. We can print the report by choosing our printer and pressing OK.
Number 11. How much does the practice have in credit balances? What is the aging on the credit balance report?
This report is about the same as the last report we looked at, with the exception of a couple of filters, and I'll show you right now. So we go up to the word Reports in the toolbar, Ledger, and Aging Report, and we keep everything the same as the last report: guarantor, provider, billing type, and select over 0 days. By guarantor, the exception is we deselect standard aging and click on credit balances, and then press OK, and we can highlight and double click and preview that report, and then print it with the word File in the upper left corner.
Number 12. What insurance plans are the providers in network with?
As far as what insurance providers the doctors are in network with, I go to the word Maintenance, Practice Setup, Definitions, and under Definition Type, I go to Fee Schedule Names, and I can look and see which PPOs the doctor is in network with: Delta, Aetna, Guardian, MetLife, Aflac, and then scroll down. And keep in mind, there can be quite a few PPOs that the doctor is contracted with. And just press close, and there you have it.
Number 13. How many outstanding insurance claims does the practice have?
We are still in the batch processor window in our Dentrix, and we can go up to the word Reports, Ledger, Insurance Aging Report, and with this filter we want to keep the patients at all, the carriers at all, provider at all, and then minimum days past due. For this report, I select over 0, and then press OK. And there you have it. There's our report. I'm going to highlight it, double click, and it will open up. And this report will not necessarily give us a count of all the claims, but we can go back to that filter and we can click on the 30 days, the 60 days, or the 90 days, and we can do a manual count of how many claims are in each category. But this report right here is the overall report, and it will give us all the claims. In order to print it, we can go to the word File in the upper corner, Print Report, select the printer, and press OK. But there you have it. Once you have finished printing all of the reports that you need to clear out the batch processor. And how we do that is as simple as clicking on the trash can here in the toolbar and selecting all reports and OK. If there are reports already in the batch when you start and you don't want to disturb those reports, then you would come up here, highlight the reports you want to delete, and click on selected reports and click OK, and all of those reports will be deleted.
All of this plus much, much more is covered in my virtual course, Reports, Monitors, and Statistics. For more information, you can visit dentalpracticecareers.com.